So October is Breast Cancer Awareness Month. Dr. Rachel Haley of HCA Midwest Health explains why now more than ever, taking care of yourself when it matters, well, you're going to have to do that when it comes to regular health screenings. Dr. Haley, many hospitals and doctors' offices limited patient appointments and surgeries during the beginning of the pandemic, which caused many non-COVID health concerns to be pushed. How has that impacted breast cancer?
In March of this year alone, compared to prior U.S. averages, data showed a staggering drop of more than 90% in routine screenings for breast, cervical, and colon cancers. The declines are certainly connected to the public health alerts from trusted institutions such as the CDC, which suggested delaying non-urgent procedures and screenings, guidelines that everyone followed, including the Sarah Cannon Cancer Institute at HCA Midwest Health. Understandably, though, confusion and caution has caused declines in screenings as well. But along with delayed screenings comes concern about the greater number of late-stage breast cancer diagnoses that may occur. This year alone, according to the American College of Surgeons, more than 250,000 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S.
Why exactly are mammograms essential when it comes to detecting breast cancer?
Mammograms can reveal abnormalities that are not detectable clinically, and early detection is key in surviving breast cancer.
So during the pandemic, should women still get their annual screening?
Absolutely. It's essential for women to know when they should get screened or follow up on an appointment that may have been delayed or rescheduled. If you need a mammogram or notice something doesn't feel quite right, don't hesitate to call your healthcare provider immediately.
Let's take a look at those age guidelines for screenings and what are some of the risk factors that women need to be aware of?
Well, although a mammogram may not be urgent for many women, it is most certainly essential for others. And because guidelines vary greatly as when to begin mammograms, the only way to be confident about your breast health is to know your risk factors and work closely with your healthcare provider. From age to family history to genetic mutations, your risk factors for breast cancer matter. And as far as risk factors, there are ones that we can't change, such as getting older. In fact, 2/3 of invasive breast cancers occur in women over the age of 55. Also, genetic mutations like the BRCA genes, starting menstruation before the age of 12, going through menopause after the age of 55, dense breasts, and personal and family histories of breast cancer are also risk factors you have no control over. But there are risk factors that you can change, such as lack of exercise, being overweight, drinking excessive alcohol, having your first pregnancy after the age of 30, not breastfeeding, and smoking.
What about the risk factors tied to COVID-19 that women should take into consideration before they get screened?
Well, if you are over the age of 60 or have underlying health conditions, work closely with your doctor. Determine additional safety precautions to take or when it is safer for you to get screened.
And then if we don't have any symptoms, can we delay a breast health screening?
Well, waiting 1 month to delay a screening shouldn't make a clinical difference, but waiting several months certainly could. If you have no symptoms and are due for a check, don't hesitate to have a regular screening. However, if you notice symptoms, if something looks or feels different, if you find irregularities in your breast such as lumps, redness, or nipple discharge, consult with your doctor and make an appointment for imaging immediately. I challenge all of us to encourage the women in our lives, mothers, sisters, grandmothers, friends, and even work colleagues, get their mammograms. It's an essential part of women's health.
Great reminders there from Dr. Haley. For more information and to schedule a screening, go to hcamidwest.com/mammogram.